The next team that we have here is going to be Genetics Advisor. In a world where demand for genetic testing far outpaces specialist availability, Genetics Advisor transforms and scales the genetic testing journey with an evidence-based platform used in over a decade of clinical trials. Yvonne, over to you.
Thank you very much. So Genetics Advisor is a patient engagement digital health platform. It's a B2B business model where doctors license this product in order to support their patients for whom they're ordering genetic testing. It is completely adaptable, plug and play into any clinician's workflow. It's accessible to patients on any of their devices, meets global security and compliance standards, and available in any language. Let me tell you more. In my 20 years of being in the genomics and precision medicine field as the Canada Research Chair and Global KOL in the digital genomics space, I've never seen the market being so ready for adoption of this kind of technology. And there's three drivers. First, genetic testing and sequencing costs have dramatically dropped from $50,000 taking months in order to process to about $500 an hour to take. So we are now at a scalable place for adoption clinically. Further, clinical adoption guidelines are increasing across all areas of medicine, in cancer, heart diseases, neurology, etc. There are more and more clinical practice professional guidelines that are requiring and highly recommending doctors order genetic testing in order to figure out which drugs to prescribe, what the doses are, and what surgical or other treatments would be available to personalize their care, leading to better patient outcomes. And finally, because these clinical adoption guidelines exist, we've got payers now reimbursing for genetic testing as well as genetic services to support patients who are having testing. And this is leading to large projections in terms of the genetics and precision medicine market by 2034. But the problem right now is that the doctors on the front lines that are required to genetically test their patients were never really genetic experts, okay? These cardiologists, the oncologists, neurologists, etc., are shirking away from ordering genetic testing only because they don't have the genetic expertise to counsel, consent, and explain results to patients what are technically challenging. And as a result, genetic testing is dramatically underused, and we're seeing very little uptake in terms of testing because of the clinical lack of expertise by these providers. And this is across the lifespan, from whether it's newborns, reproductive testing, or even cancer, which is a fundamentally genetic condition. Patients genetic testing is only up to 5 to 7% and 30% in some spaces. So what if we harnessed the genetics expertise of genetics professionals, genetic counselors, and make that available through a digital platform so that patients can be offered the counseling, the education, the consenting, and the explanation of those results, offloading that expertise and burden off of these doctors. And that's exactly what we've done. So for the patients, we've created a digital web-based app that the provider or clinician allows the patients to get access to through a QR code or at the point of care at their clinic, to do that education, decision to support and informed consent in advance or following a consult. And the patients are essentially managed by the clinical team on the back end by the clinical dashboard that's available to the providers. And then results are shared online through whatever laboratory workflows already exist, and supporting the patients through the ongoing consults and options that are available to support patients. So that's what we built, and this was actually a competitive advantage of ours because in my lab at St. Michael's Hospital, we've actually done 15 years of R&D research, co-designing the platform for patients as well as by clinical experts to make sure it's centered on their needs, using industry standards in terms of clinical standards and validation, taking it through randomized clinical trials, and being adopted by both labs, pharma, researchers, point of care settings, and oncology, cardiology practices, as well as genetic services internationally. And what this means for a patient right now is that they're on a diagnostic odyssey, waiting years for consults with their doctors, waiting for tests to be ordered, waiting for those tests to be processed, then sitting waiting for those tests to be explained to them by another consult. And this goes on for years for patients who are looking for answers to their own problems, as well as to try to find answers for their children as to what is causing their disorder and whether it's genetic in nature. With the genetics advisor, we could cut this entire diagnostic odyssey, which is costly and also extremely stressful and delays access to care for patients by days to weeks, by essentially streamlining all of that into a digital platform. And we've actually found through 10 years of clinical validation and randomized trials that the use of the genetics advisor in advance to a consult actually saves the doctor over 60% in consult time, because effectively they've offloaded the education, the counseling, the consenting, the explanations in advance of their consult, reserving that time for patient-centered care and the last questions the patient might need. And again, it is not at the jeopardizing patient care, because patient-reported outcomes from these trials show 95 plus satisfaction rates, 96% consent or completion rates, very high surpassing industry standards in terms of retention rates, and all of the patient-centered care outcomes in terms of increased knowledge, patient knowledge and empowerment, reduced distress and anxiety, and improved patient-provider interactions, all leading to better adherence and improved outcomes for patients. The precision medicine market is actually huge and is rapidly expanding. We are currently servicing and have contracts, both paid and pilots, that have converted in fertility, oncology, cardiology, newborn screening, lab, pharma, and population screening programs across the world. And we're actually going to be expanding into the clinical trials, liquid biopsy, biomarker testing, as well as employee health benefit plans. We've also enjoyed global traction with leading institutions around the world across all the settings that I've already described, showing the market's ready, product market fit, and people are willing to pay for this. We've built out the team. I myself am global KOL in digital genomics and a leading scholar with both the R&D and clinical expertise in the space, stood up by expertise across financing, venture capital, growth, marketing strategies, as well as tech and finance, as well as product market development. We actually founded the company in 2022 as a spin out of St. Michael's Hospital. We raised pre-seed round in 2023, grew the team, brought the tech in-house into the company, and are now being asked by very large US health systems, as well as others, Cedars-Sinai in LA and CHIO, et cetera, across Canada, to start to integrate our platform into electronic medical records like Epic, and have opened up a seed round in order to build out the tech team as well as the marketing and sales team in order to capitalize on that opportunity. So we are opening up a 1 million equity round of preferred shares. We have already 3/4 of it committed, looking for the last quarter, providing a runway of 18 months to take us into our Series A, which is early next year. And the use of proceeds will be to hire our sales, customer success, operations, and tech team for the integration. That is it for my pitch, and I'll leave out my contact details here. Thanks very much. Open for questions.
Thank you so much, Juan. We have a couple of questions in the chat. First question: does this app reduce the work need of genetic counselors, or would genetic counselors use the app?
They themselves are the ones coming and clamoring to use the app, because quite frankly, they recognize that that they can operate top of scope if they use this app. They don't need to do the routine repetitive explanation of what genes are, genetic testing is, what a positive result means, and instead they're reserving their time to actually have that patient-centered consult with the patient. So it's actually supporting genetic counselors and being used as an adjunct to them in those settings.
Great. And then the last question here we have: who is your target client? Is a service like that covered by health insurance?
So the target clients are hospital systems, pharma, and government population screening programs. Insurance right now requires that any genetic test be supported by professional services to counsel and consent patients, and that is reimbursable, as well as the genetic test itself. And so that is driving the use and need for these alternative low-cost strategies in order to scale the support of genetic services across spaces like cardiology, oncology, neurology, and for population screening programs that are actually offering direct to the public genetic testing and screening for fertility options, for cancer, heart disease, et cetera. And those are the hospital systems, government, that are paying for our services. Again, that's a B2B licensing model plus recurring revenue for subscriptions, and they're being covered by governments and even sponsored by pharma in order to actually scale the identification of patients for their targeted therapeutics.
Thank you for taking the time to answer the questions. We are at time. We have other questions in the chat, but the screen for Genetics Advisors contact information is up. So feel free to reach out to them directly for more questions. Thank you very much.